hidden. There's never been a moment you were forgotten. You are not hopeless. This podcast is devoted to having those hard conversations that are essential to drug prevention and harm reduction. The Prevention Project will take that deeper than deep dive by engaging with experts in addiction, healthcare specialists, first responders, and real people with lived experience. Our goal is to offer listeners crucial information about addiction while providing knowledge and support. We want people to be aware of why harm reduction is essential, along with everyday strategies for staying safe. Join us as we break down the walls of stigma and empower our audience. I hear your SOS, your SOS.
Welcome to the Prevention Project podcast for November 2024. My name is Steve Berry. I'm the Division Director for SWOTA's Substance Use Prevention, Treatment, and Recovery. And along with our team that you hear every month, we also have a special guest, Christy Kerfoot-Tidwell. Christy, introduce yourself.
Hello, thank you, Steve. I am out of District 1 with the Oklahoma State Department of Health. We serve 10 counties up there in northwest Oklahoma. And I'm the health equity specialist up there. I also do some of our community engagement and some of our health education through like type 2 diabetes education classes, something we will be discussing today. We also do Tai Chi for the aging population for better balance. We also do the Healthy Heart Ambassador for those that have hypertension, and that has a nutrition component with it as well. Also teach Bridges Out of Poverty for individuals that are interested in learning.
You're a really busy person. We appreciate you taking your time to be with us today. We have a list of questions that we came up with as a group that we want to talk about, specifically related to diabetes, and then hopefully being able to tie that in with substance misuse and substance use disorder. So, Kendra, why don't you kick us off?
Yeah, so we deal with a lot of stigma in substance use disorder prevention and treatment, and we don't want to contribute to that stigma for other folks. And so is it preferable to say diabetics or diabetic patients or patients with diabetes? Is there a preferred way to address those folks?
I prefer to use the people or individuals with diabetes or people or individuals living with diabetes, as we usually use the word patient in the more the clinical setting and everything, or a hospital setting. I feel like when we use the word patient, sometimes we can dehumanize a person and make them feel as though they are like the condition instead of they're just an individual who has that condition, and we don't want them living like that's their identity or classification, but they are a human, just having that condition.
That's that trauma-informed care piece that you put in there, so that's really nice for those folks.
Yeah, person-centered care, it's a common practice in substance use disorder treatment as well, where we try to affirm people and empower them to take control, make decisions of their own life, especially in their care. You told us a lot of the programs that you do and a lot of the services that you provide throughout the health department. How can people get in contact with you?
They can contact me a few different ways. They can contact me via telephone at my home base, and that's in Alva. That phone number is 580-327-3192. Or they can contact me at my email address, and this was very long. It's Christy.Kerfoot-Tidwell. So that's CHRISTY.KER, F as in Frank, OOT -TIDWELL at health.ok.gov.
Boy, that's a big one.
Yes. Yep.
How do you all promote diabetes awareness at the health department? Do you have programs to help folks with diabetes education and awareness?
Yes, we promote diabetes through a few different ways. That might be with our partners sometimes if they reach out to us. And if they do, I will set up a class for them, those kind of things. But that's really that's how it is. And then we teach the classes as well. We try to get out to the public as much as often to let them know that we teach those classes.
That's pretty cool. That you guys offer all of those classes to get that education out there. Christy, can you tell us how many types of diabetes there are and what are the difference between them?
Absolutely. There's 3 types. Actually, there's more than 3 types, but there's 3 main types. The 3 main types are type 1, type 2, and gestational diabetes. Type 1 is usually called insulin-dependent diabetes mellitus or IDDM, and that used to be called juvenile diabetes, and that's because individuals who were children or were younger were the ones who were being diagnosed with it. So, with that in mind, this condition, the body does not make or create enough insulin. The root cause is still not completely known, but there is still research being done to find more answers for those living with type 1 diabetes. Individuals are usually on an insulin pump when they have this diagnosis. I always remind individuals who are using insulin pumps to regularly check the battery life of their pump and to carry extra battery with them just in case, because I don't know how many of us, even with our cell phone, we're like, oops, and then we try to recharge it. And that's a different case for those that have a diabetes pump. They also need to check their insulin level and how much insulin they do have left in their pump. Otherwise, if it malfunctions in either manner, it is pretty dire of a situation. And if an individual has a lot of questions or they're in doubt, they can always check with their doctor or their primary care provider or even the pharmacist. The pharmacist can help too.
Right. What is a insulin pump? Can you let us know what that kind of is?
It looks a little bit like a pager, the size of a pager, and inside it there's battery and there's also a vial of insulin. And so that person they'll put it in a different site and they'll alternate sites whenever they do it, but there's a tube that they put into their body and it kind of coils around in there. And so it monitors and it continually provides that insulin to that person. So if the battery life fails or they don't have enough insulin with what they're doing, their blood sugar can get too high because insulin is a hormone and it reduces your blood glucose. If it gets too high, it can lead to coma or death.
Right.
And especially individuals like out here in rural America, we drive a lot. So sometimes, if your blood sugar gets way too high and you're driving, that's an endangerment to others and not just yourself too. But more than anything, you really need to be aware that you have, enough insulin or a battery life.
Okay. So what would be the difference from a person that was needing that pump or someone that was just needing to inject the insulin with a syringe?
That's a type 2 diabetes.
Okay.
So type 1 is they're completely dependent on that insulin pump. Type 2 diabetes is also called the non-insulin diabetes mellitus or NIDDM, meaning that the body produces some but does not create enough insulin, or it develops insulin resistance, which can happen through weight gain and things like that. It requires insulin that is taken either orally or by injection as needed by the individual. And type 2 diabetes can be caused by a multitude of factors like genetics, aging, inactivity, like I mentioned earlier, obesity, and there's many more reasons. But those are the main ones.
Okay, so those are the main 2 types, type 1, type 2.
And then you have gestational. So the third one. Gestational diabetes is a condition that occurs or arises during pregnancy when the body cannot produce enough insulin during your pregnancy or your body develops insulin resistance. The researchers, they're not really sure why some pregnant women get the gestational diabetes and some don't, because even some of them are thinner individuals, and so it's not really a completely understood thing because some moms are overweight and do not develop it. Some are and do. And then on the other spectrum, you have your thinner moms who develop gestational diabetes or they have a completely healthy pregnancy. So there's just a lot of information that they're not sure on that yet. But when you do have gestational diabetes, Your healthcare team may have you do checkups or more often screenings, or doing screenings more often during your pregnancy. But again, that's determined by your healthcare team. Usually, a person's blood sugars will return to normal after a delivery, but research has shown that if you have gestational diabetes, you have a higher risk of developing type 2 diabetes. And that'll just be a conversation that you'll have to have with your healthcare provider, how concerned they are, how they monitor that. But there's quite a few different types of diabetes, but those are the three main ones.
Is gestational diabetes, is that a predictor for the child in their risk?
There's still being research done on that, but some of that has been seen, but like I said, it can go either direction, but they're still doing research on that. So that's not a definitive answer.
So, Christy, I just want to thank you again for driving all that way to be here with us and to share your information. My dad is diabetic, and I've already learned so much just in the last few minutes. So, how many types of, how prevalent is diabetes and or prediabetes in Oklahoma? And why is it so urgent for pre-diabetics to start taking action to slow down or stop the process?
So I'll start with the prevention part first. I know that I've always been taught an ounce of prevention is worth a pound of cure. Mm-hmm. So if you can get on that sooner than later, you can help mitigate a lot of that. You know, if it's due to lifestyle choices, just start making better lifestyle choices like reducing, your carbs or your caloric intake, being kinder to your body, go on walks, go and be more active. That assists the body in a lot of things. I know that something that individuals don't talk about much is like cortisol. It's like sometimes that can cause an inhibit to your insulin, or cause some of your insulin resistance. And the more you can be kind to yourself, the more you can go on walks, reduce your stress level. That can help a lot.
Okay, great. And so how can families support their loved ones who have diabetes?
That's hard sometimes. Sometimes individuals don't have family members that are very supportive of that because they're not living with the condition. Mm-hmm. Sometimes it's easier if they do come to a class, and that's something that we do promote, is if an individual is attending one of our type 2 diabetes education classes, that they bring somebody with them, somebody who supports them or is a champion in their life, so that they can help that person even through the hard moments of, I'm not going to go eat this today, let's go on a walk, let's redirect or reroute. But it's also helpful for family members to see the toll that this condition can take on the body.
Great, thank you.
Mm-hmm.
Since this is such a big problem in Oklahoma, what are impacts on our state? I know there's related healthcare costs. Could there be lost time at work, decreased productivity at work, mental health issues? What are some common impacts to patients and families?
Absolutely. I'm going to provide you with a lot of statistics. It's starting to, diabetics is starting to take action. It's slow down or to stop progress. It's really hard to get ahead of this due to access sometimes to healthcare providers or individuals. I know that I've had a few clients are like, oh, I have diabetes, but I'm not really concerned about it because I've had this my whole life. And I'm like, and so they're not seeing the need to preserve their life and to make that decision. So sometimes there's not a provider, and out in rural America, we are a provider desert on that. A lot of times we have individuals who are on Medicaid, and thanks to SWOTA and everything else in our transportation, we're able to call in sometimes and get, a code that we're able to use so that individual can get on Sooner Ride to get to the city to see like an endocrinologist or someone that can help them better. But it is the 8th leading cause of death in Oklahoma. Oof. Yeah. It was determined to be the underlying cause of death in over 1,500 people in 2020. Individuals with diabetes also have a twofold higher risk of death than individuals without diabetes. And the diabetic patients often pay up to 2.3 times more for their health care than their non-diabetic peers, and that is a lot. In Oklahoma, diabetes and pre-diabetes related costs are estimated to be $3.7 billion annually, every year.
Wow.
Yep. The CDC estimates that 34.5%, so that'd be over 1 million Oklahomans may have prediabetes, a precursor to the type 2 diabetes.
In the state of 4 million people.
Yes, sir.
That's a lot.
That
Yeah.
is. That's
Yes.
very astounding.
Yes. As education and income levels increase, we also see that the prevalence of diabetes decreases. But sometimes you have to help someone become the driver in their own health care. Diabetes related comorbidities also play a risk, like heart attack, stroke, and arthritis. And another something else with the CDC, they said that through our 2,320 CDC cooperative agreement focusing on diabetes prevention and management, we are working to improve health outcomes for people at risk and living with diabetes. Some of our efforts include increasing access to diabetes prevention program, as well as diabetes self-management education and support programs through the state. And that's through teaching a lot of the type 2 diabetes education classes. We also have some districts that have nutritionists, and we also reach out to other individuals in communities. So there's a partner that has dietitians that can go and do cooking demonstrations and things like that, and we're putting them in connection with Connection Food and Resource Center to hopefully be able to provide that. So I also print out and give resources to our individuals, but I digress, sorry. In District 1 specifically, we have 2 health educators who offer diabetes support programs within their county or within our county health departments to help people living with diabetes take that extra step.
That sounds great. It sounds like y'all are really pushing a natural way to heal or deal with diabetes, which I always think is great, instead of just pushing medications. That's awesome programs.
In our diabetes education classes, we also cover the different kinds of medications to help the individual learn more about what they're taking. In Custer County, we are also partnershiped with the pharmacy department there at SWASU. And they come in and pull like A1Cs and free cholesterols for the individuals who are attending.
That is amazing.
Yeah.
So if a person living in a rural community thought, hey, I know a lot of my friends or family members are diabetics, I think these education programs would be awesome. What does the community need to do to initiate that process, to bring those services? Or is it patient initiated?
It depends. So can do either one, really. If we have individuals saying, hey, we want to learn more about this, could we have a class? Yes, I could provide a class to that. Generally, it's just for individuals who have type 2 diabetes. However, I have had individuals attend my class who their grandchild or another family member has type 2 diabetes, and they want to know more about it and know how to go about assisting it. Even as specific as, we have Thanksgiving and Christmas coming up.
Yeah.
What modifications can they make to ensure that person still feels accepted at the table, or feels like they can come to the table, not going to be overwhelmed with the decisions?
Yeah, my granddaughter has type 1 and she lives in Iowa. And of course, we just had Halloween. And so the other kids were going house to house and loading up on candy, and that really wasn't an option for her. So my son and dad and mom had to find some alternatives for her to celebrate where she could still have fun but be safe and be healthy while doing it. And Valentine's Day is another challenge, and Christmas and all those other times where we all like to celebrate with sweets and reward ourselves. And so
And that
it
can be
can
really
be.
hard.
Yeah.
I
especially
will
for kids.
add,
Yeah.
this is just something I knew. Halloween, if you look for blue pumpkins outside of a house, it typically means that they have non-candy alternatives for trick-or-treaters. I will add that one.
That's good to know.
Yeah.
Blue or teal pumpkins.
I want to switch gears here just for a little bit. I wanted to talk about and see if you know of the ties or want to share about the ties between diabetes and substance use disorder.
Sure. Yes, there's quite a few strong connections with that between type 2 diabetes and substance use disorders, mostly from increased cell damage due to the effects of the opioids on the glucose homeostasis and like being in proper balance with itself. Each substance, of course, affects the body and its system in different ways, but each of those will compound or enhance the effects of diabetes and what it has on your body. Diabetes has the ability to affect the whole body, starting the top of your head running to the bottom of your feet. So starting with the blood vessels or the whole vascular system in general, as the body, in part, every part of it has a vascular system and can damage blood vessels in the brain and cause stroke or memory loss. It can even cause damaged blood vessels in the brain and cause you to have a stroke or memory loss or blindness, as we had spoke about. Uncontrolled high blood sugars can also increase the cavities and the gum disease. And a lot of things individuals don't realize is once you lose your teeth, you start losing that muscle mass, or not muscle mass, sorry, your bone mass within your jaw and everything. Another thing individuals don't realize is that infection. So if they have those abscesses and then they don't take care of them, it can go to your heart or your brain, but it will poison the body. And then another thing is when your blood sugar is really high, you'll get thrush, or you won't always, but you can. You can get thrush in your mouth, which is very uncomfortable for
That's a
individuals.
yeast infection in your mouth, right?
Yes, ma'am. That's exactly what it is. Yep. And then it can also cause damage to your blood vessels, to your heart, through having a heart attack or hypertension or heart failure of some sort. It can also cause damage to the filtering units of your kidneys. Sometimes we'll see people who have uncontrolled diabetes or type 2 diabetes for a long time will develop renal or kidney issues due to a lot of different reasons, but that is something that happens. And then that can lead to your chronic kidney disease or kidney failure, and that means the person's going to be on dialysis. It can also cause issues for your nerves, which most individuals with diabetes are already aware of due to the neuropathy that they experience, which is that tingling and numbing feeling sensation in the bottom of the feet, which then becomes a bigger issue as well because I myself as a person, I do not like to wear shoes. I like to walk around barefoot. My dad is much the same, and he is a type 2 diabetic, and he's a farmer. So he wears shoes, of course, to farm in. But, stickers and things get in his shoes. I go and look at his feet on the regular, like almost daily, to make sure that he doesn't have a sticker in it because my mom's also an older individual, doesn't always see everything. So I want to make sure that he keeps all his toes and we don't have any issues. Because it can get out of hand before a person realizes that something's going on. It can even infect the intestines and how the food moves in the body, such as gastroparesis, which is a condition that slows down the digestion by delaying the stomach from being able to empty properly. And that is also a condition that will compound on itself within the body if you don't get control of your type 2 diabetes and your sugar level, because that vascularization that's at the bottom will continue to just get worse if you get the gastroparesis part. But most individuals think about the heart when we talk about the blood vessels in the heart or extremities, but a lot of the time the individuals, they forget that our whole body is lined with the vascularization. even like our organs, like I was talking about with the gastroparesis, but also our teeth and our bones. And a lot of people don't think about that. And when you have type 2 diabetes in general, your healing process is a lot slower than everybody else, and you catch illnesses a lot easier because you have a reduced immune system.
So it sounds like injection sites from substance use would be a huge issue
It could
if
be.
you are type 1 or type 2 diabetic.
Could be. For example, alcohol use will cause a person's blood sugar to get higher, or an individual that is using marijuana may experience an increased appetite, so causing them to overeat whenever they use the word getting the munchies and things. And that will also have a negative consequence on the body's sugar level, or even tobacco use that causes, many, many different things on the body, pretty significant. But it has a significant impact on reducing your blood circulation too within the body, which diabetes is already taking a toll on. If it's uncontrolled, type 2 diabetes, I should say. Yeah, if it's uncontrolled, it'll reduce your circulation to the body.
Well, I think you covered a lot of connections between substance use and diabetes, but it's just a couple other things. Even if a person's using responsibly, they have maybe one drink at dinner or something like that, or they have to use some prescription stimulants or prescription opioids to manage pain and things like that. But do you have anything else you want to add to that about substance use complicating treatment?
I can say that it makes the treatment not as effective. Insulin is used to assist those living with diabetes for a better, fuller life. But that's if they're taking medication prescribed by their physician. That is a discussion that they really need to have with their physician on maybe the time that they take their medication, or the dosage that they need to take, or maybe just a different medication altogether. Whenever I teach about the education part of our diabetes program, I let them know it's like we as individuals have DNA within our body, and all of us have different DNA. Medications also have their own DNA, and sometimes they don't get along with us, and that's why some medication works well for others and not so much for other individuals. But it's specific to what one's going to work well with your DNA, really with your body and stuff. So if there's an issue with their prescribed medications, they really need to speak with their physician or their specialist on an alternative treatment or a better treatment, or how to assist with those things.
Okay.
Christy? Oops.
Go ahead.
Christy, is the need to reduce or stop using substances part of the diabetic education programs?
It is touched on that alcohol and tobacco use can increase issues that arise from the complications of uncontrolled type 2 diabetes, but that's about what it goes into, what it entails. And that's a lot of different avenues.
Right.
Like I had said, there was an individual who stopped using tobacco at one of our classes after they realized that they're not healing as well as they probably could be. They were a farmer. They're like, well, yeah, I get cut on the arm or whatever, dealing with barbed wire, this or that. And being a farmer, I understand that myself. You can't always get away from those kind of things.
Yeah.
And I started talking about, your vascularization within your body. Even your skin is an organ and has vascularization, and it's your barrier, your best barrier. And smoking causes those blood vessels to shrink up, and for the blood flow to really not get there. I was like, so you're going to have delayed healing on a lot of different levels.
Yeah.
And he really, because his wife had really tried to tell him that he needed to stop smoking because of his type 2 diabetes, because the neuropathy in his feet was just going to get worse, and these other health conditions that this individual had. And as we went through the class, he was able to see, like, oh, and a lot of the responses, they're like, why do they not teach us this, elsewise?
Right.
And I think that's because type 2 diabetes has been around for a while. And sometimes they forget that people don't know. It's like, we can't assume, like, I can't know everything that's in your brain. You don't know everything that's in my brain. But I can't expect somebody to know something that I know. But I think a lot of times that's something that we do as just human beings. And then we don't realize people don't know things.
Well,
I thought,
there's a risk too of compassion fatigue among our caregivers too, our medical professionals, our family members who invest so much time in treating these illnesses and conditions and diseases that require a lifestyle change for treatment. And diabetes certainly fits that, substance use disorder fits that. And it's also one of the most difficult things. And people with substance use disorder, one of the last things that they learn in recovery is how to advocate for themselves. But it's also one of the first skills that they need to get proper care and engagement with the folks around them. But compassion fatigue is, we feel like we've given that message 100 times, but to different patients or different folks in our community. But the realization is that individual who's just gotten a diagnosis may be listening for the first time. And that's why consistent messaging, consistent application, and taking advantage of all those opportunities to continue to push that out, that there is treatment for diabetes, there is treatment for substance use disorder. There are folks, professionals, who can be a guide to you and lead you in a more positive, self-affirming direction so that you can live the best possible life. There may be some permanent damage already being done, but let's make the most of what's left. And maybe you're, like you mentioned, your eyesight. Maybe your eyesight's starting to be impacted, but let's try to do what we can to preserve what's still there, rather than just giving up and giving in to the long, slow, steady decline.
Well, and if you're a caregiver, to also remember to take care of yourself so you can continue to be that resource for people as well. So, and Christy, we really want to thank you for being with us for National Family Caregivers Month and National Diabetes Month. And we just had one last question for you to pick your brain, because you have so much knowledge and we appreciate you sharing that with us. But what are some other resources for diabetic patients and their caregivers that you can share with us today?
Something that I do provide in my classes is something from the CDC, and that has additional information to those that are attending the classes, or even if they want to give that to a loved one that they know. But it has a lot of information from what diabetes is and the different components on the body and what it affects. Also tells them how often, if they forget, even though I give pamphlets in the class, but if they forget, oh, I need to have my eyesight checked this often, I need to have my labs done this often, and gives them more tools of what those tools that they need to use, or if they want to go and research it themselves to learn a little more, or their family member wants to learn a little more. I also provide them with 2 different websites that they can go to, and they can print off recipes, but they can enter anything and everything that they have in their pantry or home food-wise, and it'll generate recipes for them, and you can filter it down to whether it needs to be diabetic friendly, or so a diabetic friendly meals is what they call that, or a healthy heart, so low sodium diet.
That's neat. It is. It really is.
And you said it was a website?
There's 2 different websites that you can utilize for that. Yep. And then I also let individuals know that if they're on Medicaid or Medicare, those recipients are allotted so many hours a year to see a nutritional counselor free of cost if they would like to do that. And some of those nutritional counselors, you can do those classes online, or not classes, but have those meetings, those appointments online. They don't always have to go in person because a lot of them live towards Oklahoma City, Edmond, Norman, those places. And that some of your private insurance companies, as part of a preventive, because they're starting to see the need for that, also offer that as a benefit. Some of our hospitals, so our clientele that live in our area but go to hospitals in other areas, so like say Enid, or they're outside of our district but they live in our district, they'll send a referral to me and I'll do an impromptu class for those individuals because it's a necessity. They don't need to be waiting a month or two until we have a next class. So I've had a few times where I do an impromptu class when I've received, I'm like, oh, okay, we need to do this now. And the individuals are always really receptive in coming in. The case management's always really happy to be able to get them services.
I feel like we see it on Facebook a lot, or TikTok. We see these reels where they talk about, they enact skits where a farmer is coming into the ER for services because the stereotype with farmers, ranchers, and even truckers is they wait until the very last minute to get the care that they need. Steve's over here raising his hand. How important is it for a person to get that care as soon as possible?
I think that's a male trait.
It is a man. I wasn't going to stereotype it as men, but
it's a female trait too.
Yeah.
It's like some of us have a really high pain tolerance. We don't realize what's going on until we've done a lot of damage and we're like, oh, I can't walk. So I'm actually on that spectrum. I went to the neurologist and they thought I came in a wheelchair whenever they looked at my MRI, and I was like, no, I'm walking. And they're like, oh, wow. Yeah, sorry, I think I just kicked you. I didn't mean to. But to answer your question, how do we help them understand to get care sooner?
yeah.
Do your annual checkups with your physician, and know that diabetes is something that you have to stay on top of. But if you stay on top of it, it's not so bad. But it's whenever you just throw it to the wind and you're like, it's not going to bother me. I've got other things. When you could be living a better life, when you wake up and you're tired in the morning, you could be waking up not feeling quite so tired, or having other issues. But like Steve said, is making the most of it. So even if your body does have a little bit of damage, you still have the chance to prolong your life for the betterment of it. Mm-hmm. So, but it's really to emphasize to them that go to your doctor.
Prioritize your health.
Yes.
Yeah, and sometimes I think too, having the option to do a telehealth visit, from your own home, or meeting a health educator in an informal setting rather than a clinic sometimes helps break down those barriers, and folks can feel a little more comfortable. They don't get that anxiety of going into a sterile clinic, and sitting on the table covered in paper. Mm-hmm. And having somebody check their blood pressure and all that stuff. Sometimes that more informal approach, can break those barriers. So, again, really thank you so much for your time today, Christy. Thank you for the Oklahoma State Department of Health for loaning your services to us for just a little while today. Christy's phone number is 580-327-3192, 580-327-3192. Call her, ask her about what specific questions you have or needs that you have. If you can't help somebody, what are you going to do?
Well, I'm going to refer them to somebody.
There you go. That's the right answer. She'll find somebody who can. Yeah. Do you want to give your email address again? I'm not even going to try.
Absolutely. It's CHRISTY.KER, F as in foot, OOT, -TIDWELL at health.ok.gov. And I don't know if I can mention this, but our health department does provide a lot of other services too, that individuals aren't aware of. Like our CHW and our PRN program. So that's a community health worker or a pregnancy resource navigator. our CHWs can help get individuals signed up for Sooner Care or Medicaid. They can also help get individuals signed up for SNAP or what individuals usually call food stamps if they're needing that. And sometimes also when you're diabetic and you're trying to eat healthy, sometimes that's a huge barrier. So if that's something, use that resource. That's why it's there. Pregnancy Resource Navigator, they can provide all sorts of different things for the individual and resources on that. I know I keep saying the word resource, but it is a lot that is there. And if a person qualifies, they can get a free car seat even, and it'll be installed for them. And as their child ages, they'll age out of their car seat and everything, a new car seat will be given. So as the child ages, a new car seat is provided.
We have a lot of grandparents who are taking care of their grandkids as the primary caregiver for those kids, and first time around dealing with car seat, how does it fit and things like that. So it's nice to be able to go to a local health department and talk to someone who's an expert, have them look at your kid, have them look at your car seat, make sure that your kiddo's protected in the best way possible.
Our health departments do a lot for rural Oklahoma, so thank you for that.
Yeah, we on the child part for our grandparents and other individuals, we also have a Sooner Start program, and that assists individuals and serves their families and individuals from birth to 3 years of age at no cost, and it's a wonderful program. So it's individuals who have a delayed learning or just a delay in general. They can assist a lot, and they do an excellent job with our kiddos.
Is there a good phone number for just the health department if they need these other resources, or do we just need to have them call you and you can direct them to those other resources?
That phone number is the direct line. I should say a direct line to the health department.
Okay.
None of us have a line that's just strictly ours. Everybody has to be dispatched to us.
Awesome.
So if you call 580-327-3192, you'll have to ask for Christy.
Send out an army to find you in the middle of the darkest night. It's true, I will rescue you.
Well, welcome back. We have another guest speaker with us today, and we have Joni, and she works here at SWOTA, and I'm going to have her introduce herself and tell us a little bit about what she does.
Hi, I'm Joni Swanson. I am the information assistant and the caregiver coordinator with the aging services at SWOTA.
So we're so glad to have you here with us today.
Yes, aging services is such a vital part of SWOTA's mission and the work that we do here and in our 8-county area and beyond, right? You guys have a pretty good reach even beyond our 8-county area, but we just love what you do. You have such good quality people in your department, and thank you to Anita Martinez, your supervisor, for allowing you to be here and taking your time to speak with us today. Starting us off, just tell us about SWOTA's aging services. What resources and services do you provide?
So we provide 3 programs with our aging services. The first would be the Title III, which we provide some services directly and some that are
A little indirect.
yes.
So what is Title III?
Title III would be our services are going to be the information assistant, ombudsman, caregiver, respite program, which also includes grandparents raising grandchildren. And then the services that we contract out are going to be legal services, congregate meals, homebound meals, nutrition education, nutrition counseling, outreach, home repair, and chore services.
Wow.
That's
Whoa.
a lot. My goodness.
Yeah, so that's why it's vital for us to have a guest like this on podcast so you can tell your story and our listeners can hear about all this great things that are going on. But before we get any further, how can people contact you and what are the service areas that you work in?
So we have 8 counties that we service, and that would be Beckham County, Custer, Greer, Harmon, Jackson, Kiowa, Roger Mills, and Washtenaw counties. And you can contact me at SWOTA for any Title III services, and my number is 580-562-5026. Or you can contact, I didn't tell you about all of the services, but you can contact our main number, which is 580-562-4882 for the Advantage waiver or the Veterans Program.
We have a veterans program too?
Yes.
That's awesome.
So we are the very first in the state to get that going. We right now have 2 clients, and we're on target to get 23 more by the end of the year.
Wow. And what will you be providing those same services, I guess, for the veterans or?
Yes.
That is amazing. I'm so grateful that we have something like that in rural Oklahoma.
So,
And our podcast really doesn't have any geographical bounds, and so some of our coordinators are from Ellis County or Dewey County and from Grady County, and so we have listeners in those areas too. So if someone called you and they don't live in our 8-county area, how do you handle those calls?
There's 11 agencies across the state that I can refer them to if they're in a different part of the state.
Okay, wonderful.
And do they all do similar services, or to your knowledge, do similar
Yes.
services?
If not, then they would they're either direct services or they contract those services out.
They're just not as good as SWOTA.
Right. We're partial.
We're a little partial and innovative, so that's what we love about working here.
So it is National Caregiver Month. What are some of the pros and cons of caregiving?
So some of the pros for caregiving would be that people are going to do better when they're taking care of somebody that they love, or they're receiving care from somebody that loves them. So it's just they're more invested in that person when it's if you're taking care of your mother, you're gonna do the very best you can to give her everything she needs, right? Some cons is that caregiving is a really hard job.
Mm-hmm.
It's very exhausting in every way, physically, emotionally, mentally, spiritually. And sometimes it's really, really hard to ask for help when you're caring for somebody that you love. You feel like you have to do it all on your own, but we want you to know you don't have to do it all on your own, and it's definitely okay to help or to ask for help, because it's a really hard job. And many times I've seen where the care receiver actually outlives the caregiver because they're just so
The stress that's
exhausted.
put on them, yes.
Yes.
Yeah.
And by the time, a lot of times when people ask for help, it's to the point where they're, totally desperate. They're totally desperate. They have no resources, and it's like, we need this now. So it's really important to kind of know that, start thinking about things that you may need. And just kind of get a feel for what resources are out there available for you.
being proactive about it
Mhm.
as a caregiver. Yeah.
So
Yes.
long-term care can be really expensive. Are there a lot of benefits to caring for a loved one at home?
Yeah, most definitely, because people are going to do better when they're at home in the environment that they love, and it's just people are going to do better at home.
Well,
we
and
think.
care in a facility is expensive, so this saves the family and the taxpayers a little money, right?
Right.
One thing it seems is that a lot of people, probably older, don't plan for their long-term care ahead of time.
Right, and Medicare it does not pay for long-term care.
That's right.
So how does this work? So does somebody have to fall underneath a certain
Criteria.
income category or something?
Yes. So to receive assistance through Medicaid, which is through the state, you would have to make. It's dependent on your income. The financials, I'm not real sure on exactly the financials, but I know that it costs the state less to take care of somebody at home versus in a nursing home.
Right.
That's interesting. I didn't know that.
And people can actually, and correct me if I'm wrong, aren't in some situations family members able to get paid for staying with a loved one?
Well, there's a caregiver respite program. So that program, they don't actually get paid to care for their loved one. What it does, it funds them the money to hire someone so they could go take a break. So it doesn't necessarily pay the caregiver. It's going to fund them the money for them to pay someone so they can come in, if that makes sense.
Yeah.
So they can come in and take the break that they need, whether it's, go run and get your nails done, go to the doctor. I have one client who actually, she's a grandparent taking care of her great grandson, and she just goes to the back room and takes a nap. So it's not, you don't even necessarily
Wow.
have to leave the
Yeah.
home. You just need to be able to take a break for yourself.
Yeah.
So that would be the caregiver respite program.
And that's awesome. And we live in such a rural area too. I think that the resources that are available locally to folks probably varies to a great degree. If you live in, say, Clinton, Weatherford, Elk City, or Altus, maybe have some significant resources. Some of our smaller communities, a little bit less. And so, you mentioned caregiver burnout, fatigue. What about navigating healthcare and insurance? Do people have difficulty with that?
Yes, so that is a very, very important, and a lot of people don't think about it. I think a lot of people think a lot of times they just ignore those letters that come in the mail from Medicare or insurance, but it's very, very important, and it's just something, if you need help, you can give us a call. But yes, it's definitely something that you need to talk about and look into.
And
just,
it may not be that they're ignoring the paperwork. It may be a source of stress for them. They don't know
Yes.
how to do it. They don't know what to
Absolutely.
do, and so they get into a pinch
right,
where you come in to help.
yes.
Yeah, and yesterday you were in Granite
Yes.
at the senior nutrition site and
Yes.
helping people sign up.
Yep.
Is that something that you do regularly? And if someone come to meet you in their community, what would that look like?
I do that during open enrollment, during Medicare open enrollment, which is October 15th through December 7th of every year. And I just went there. I can do a drug plan comparison, a Part D drug plan comparison for them so they can kind of get an idea as to what they're paying for that now versus next year.
Okay. That's really important for people to budget and know what those costs are going to be. So do people need to make a reservation to see you?
I will visit each meal site, which there's one in each of my counties, 8 places, sometime between October 15th and December 7th.
Okay.
So I think this week I'm going to Weatherford. I'll be there and Thursday, and then Monday I will be in Mountain View.
Okay. So for our listeners who want to come see you either in Weatherford or Mountain View, what do they need to bring with them?
They just need to bring their Medicare card if they have it handy, and their list of medications.
Do you see a lot of issues with isolation with caregivers?
Yes, I really do. A lot of times it's hard to escape. I mean, you're constantly 24/7 taking care of somebody, so they become isolated. Yes.
Our earlier segment of our podcast, we talked about diabetes and diabetes awareness, and we know that that's a long-term condition or illness. What are some of the other things that folks deal with? That anything unusual that maybe surprised you a little bit when you got started?
Honestly, I would say that bed bugs.
Oh,
Really?
Oh, yeah.
I know that's not probably what you guys were expecting me to say,
No.
but
No.
yeah, that's a real thing, and I
Horrible.
mean, it's not something that you have to be ashamed or sad or scared to ask for
Yeah.
help. That's a big thing.
It can happen to anybody. I mean,
It really
you can just
can.
go to a hotel and not even realize that you brought it home. So, yeah, it can happen in any home.
I
Yep.
had no idea.
And you cannot rest with bed bugs.
No.
It's hard to do.
That is it's a big call, and it becomes more and more
Yeah,
and more
I bet.
frequent all the time. Yeah.
So, are your patients typically just aging into old age and having ailments from that, or do you see a lot of cancer patients or diabetic patients that are having to have caregivers?
Yeah, it's a mixture of both. It really is. I mean, I have one client that he was aging and everything was wonderful, and he had a tragic accident and he left, so we have a different variety of people.
Yeah, and we would just, if you're aging and you're in great health, be grateful for that, but also try to be prepared because sometimes circumstances can change really, really quickly with slips and falls and accidents and other things. Things can change. Now, the department that I work in, we deal a lot with substance misuse and substance use prevention. Do you see you're seeing any impact of substance misuse on either caregivers or patients? For instance, you ever see anybody diverting medications? Taking opioids from the patient for misuse, or diverting money or other support services due to substance use.
I mean, I would say that yes. I don't see it very often, but there's one particular case that really stands out, and that was happening both. Her money was being taken and her medicine. So that was a real sad situation, but finally it got resolved. With a lot of
Exploitation.
yes, and that would definitely fall under neglect and exploitation. So, in Oklahoma, it's a state that it's a mandated state where everybody is required. Like it's not our jobs to investigate it; it's our jobs to report it. So, if you think that something's going on, then it's
Mandatory reporting is key in those situations.
yep.
And that's part of what our ombudsman program does as well. So if your loved one lives in an assisted living or long-term care facility, and you think that they're not getting the care that they deserve or are entitled to, then that's part of that ombudsman program as well, as to advocate for your patient, make sure they're getting everything they deserve.
I wanted to talk about just some of the resources that we can provide through our department that kind of fall hand in hand with elderly. And one of the things is locking up your meds. We promote that a lot. Especially with elderly that, have medications and maybe they have a caregiver that's giving them their medications to make sure they're locked up, because especially if they have memory issues and things like that, trying to make sure that they're locked up so they don't take more than they need to be taking. But also, if you have issues with somebody taking your meds, then the person, the elderly person needs to make sure their meds are locked up so that somebody else can't get into them to take them and divert them other
Yeah.
places. So
I
that's
have
one of the,
several. Yeah, I have several that I've taken to assisted living facilities for them to lock up their medications. So yeah, we do see it.
Yeah. And for listeners in our 8-county SWOTA area, medication lock boxes are available through the Oklahoma Opioid Abatement Project that the Substance Use Prevention Treatment Recovery Division has. And additionally, we have Department of Mental Health grants for Jackson County, Washita County, and Beckham County that can provide locked bags for medications as well that have a little less capacity, but some people prefer a key, some people prefer a combination. And so we have options for folks to try to safely store that stuff. Another thing to piggyback off what Kendra said is medication disposal. So, maybe you get sick and you're working with your doctors and you're trying to figure out what the best course of treatment is. Maybe they prescribe something, doesn't get the results, and a month later they change your meds. What do you do with that half bottle of pills? And for most of us, it's expensive. We don't want to throw it away, but on the other hand, it's really important to get it outside the home to prevent accidental poisonings or unintentional overdose death or diversion for misuse. And so we have at-home disposal kits that we can hand out in any of our 8 SWOTA counties, and specifically in Jackson, Washita, and Beckham counties, so that people can dispose of those meds safely at home and get them out of the house, in a way that is safe and environmentally conscious. We also have drug take back events from time to time in many of our counties where you can drive through and drop off. My mother passed away from a long-term fight with cancer, and so we had shoeboxes full of half-empty containers of medications, and some of them were pain management, and some were for other reasons. But we had to find a place to get rid of those safely. Our sheriff's departments have kiosks in all 8 of our counties, and several of our police departments also have kiosks where you could simply walk in and pour your meds into the kiosk and know that it's going to be taken care of safely.
And those drug take back events happen in April and October every year. There's a National Drug Take Back Day. But if you have meds that you need to get rid of between, please utilize those disposal locations or those at-home disposal kits, especially for caregivers who lose their family members.
And shout out to our local pharmacy in Clinton, Salisbury Pharmacy in Clinton has a kiosk too, and that's the only one in the 8-county area that I know of that's not in a police or sheriff's office. So
It's an actual kiosk, huh?
yeah, you just walk into the pharmacy, it's right inside the door, and you just dump your meds in there. So
That would be nice to see more in rural Oklahoma. That would be very
Yep.
it
convenient.
is. It is. Okay. So Joni, tell us once again, how do people contact you? Give us your phone number.
You can call me at 580-562-5026. Or our main line is 580-562-4882.
Thank you so much for joining us today.
Thank you.
Whisper underneath your breath. I hear your SOS, your SOS.
The song Rescue that was used for the intro and outro segments of this podcast is brought to you by singer and songwriter Lauren Daigle. Thanks for joining our podcast today, and we hope to see you next time.
Send out an